St. Paul Medics have a patient information for St. Paul children. We're about 7 minutes out.
We're about 5 to 10 minutes out.
Patient information for region, BTA turnout.
St. Paul Medics 7 out. Yellow. I can get a doc on the line for
43, yellow patient for region. We're about 10 minutes out.
Information for region, trauma alert.
Welcome everybody, my name is Alicia Vars. I am the manager for MRCC. Today we want to talk with you a little bit about what MRCC is used for, how to contact us, when to contact us. We'll go over a little bit about what our triage acuity colors are and how to assign those. We'll talk a little bit about our radio format and what's expected of EMS when giving a report to MRCC. And then we'll talk a little bit about what the ins and outs are of what MRCC can do for you. So let's talk a little bit about what MRCC is, who we are. MRCC stands for Medical Resource Control Center. We started out at Regions Hospital in the ED in a small office down there taking calls and have recently expanded and moved out to the Bloomington area. As we take more calls, you guys take more calls, it gets busier. So we have room out here for expansion and looking to grow our team, which is fantastic. MRCC's role is really to be the conduit between EMS and hospitals. So when you are taking a patient to a hospital, you call through MRCC, we notify the hospital so that they can be prepared for you when you arrive to their ED. The other pieces that we do are helping with medical control. If you're on scene with a patient and you need medical control, you would call through MRCC. We would get that doctor on the line for you or patch them in on the radio so that you can ask them for whatever support it is you need. Another role is monitoring STAC. So if you are transporting a patient who needs ECMO, we'll get a phone call from Lifelink saying that your medic rig is transporting a patient that is waiting for ECMO and needs to be cannulated. They'll let us know of an STAC channel that is available, and all of those teams will be added to that one channel. So East MRCC will turn to the dedicated STAC channel, EMS, and the Lifelink team, along with the ECMO provider. This allows for everybody that is going to be in caring for that patient to be on the same channel to talk through any issues that might arise during transport. If there are any need to change location of where the patient needs to be transported to, everybody is all in the same channel and getting that same information. Now that I've told you a little bit about East MRCC, let's talk a little bit about our counterpart over in the West Metro. West MRCC does the same thing that East MRCC does. It's just a matter of who we help serve. So in the East Metro, we serve all of our East Metro EMS agencies and hospitals like St. Paul Fire, Lakeview, Woodbury, Regions, Woodwinds, and St. John's, for example. Where in the West Metro, they service all their West Metro EMS agencies and hospitals. For example, you have Hennepin EMS, you have Bloomington EMS, or you have Burnsville EMS, and they'll be transporting to hospitals such as Hennepin or North. The biggest differences between us is really that who contacts who when. And it is as simple as if you are an East EMS agency, you contact East. If you are a West EMS agency, you contact through the West. The different ways to contact both East MRCCs are via the radio or the phone. East MRCC has an East MRCC channel that you could find on your Armor radio system, or you can notify us via phone. West MRCC has 2 West MRCC channels, or they can be contacted via phone as well. So now let's talk a little bit about our triage acuity and how we use our color format to assign acuity to patients. So we've aligned with the MCI coloring, that red, yellow, green. It helps prepare us for those times in need, and everybody's kind of aware of what is going to be identified as a green or a yellow or a red. So first we have our green patients. Our green patients are walking wounded, those that can wait in triage. They don't need to be taking up a bed right now. They're stable, their vitals are good, let's bring them out to triage. Our next patient is the yellow patient. They can be a little bit more difficult because there's so many different things that can make a patient a yellow. Do they need to be observed right away? Do they need to be on a monitor? If they're not safe to sit in triage, let's say they are intoxicated and they can't sit in a chair unsupervised, they shouldn't go to triage. If they are not wearing clothes, they shouldn't go to triage. Those should be your yellow patients. They might need some type of intervention right away. Let that charge nurse or whoever's meeting you make that determination when they get their eyes on them. If they feel like they need to be somewhere else, they can make that decision at that time. And then we have our red patients. Our red patients are our most critical patients. You can have a red patient that doesn't need to be one of a critical activation, like a trauma team activation or a stroke. You might have a red patient who just has low blood pressure, but they need some sort of intervention right when they get to the hospital. Their mentation isn't right. And then you have your TTA, your strokes. They need immediate intervention with a specific team. And we need to get those teams activated so they're prepared and ready for you when you arrive. So you can have what's called a red medical. What does a red medical mean to East MRCC? It just means that we have a red patient. But is that patient a stroke patient? Are they in cardiac arrest? Are they, an ECMO patient? We want to know that right from the beginning. So if you have a red, you're going to call East MRCC and you're going to say, I have a stroke. I have a STEMI. And we know that that's a red. If you have just a sick patient, you have a red patient. And we're able to then identify the template we need to use to make that right notification to the EDs. And now we're going to show you the templates that we use here at East MRCC when we send notifications to our hospitals. So as you can see here, we have several templates that we use here at East MRCC. Each of these templates is dedicated to a specific hospital and then for, as you can see, all of our different activations. So if we are sending a patient, let's say a standard, green, yellow patient going over to Lakeview, we're just going to click on the Lakeview template. You can see here it's being sent to our Lakeview ED partners, and then here is the template that we use to provide them with the patient information. So each time we get a new call, we first start here. We start here at the templates, we go down to the right template that we need, and then we select that template and we start filling out that form. This is an example of what our red template looks like for regions. You can see here it's pre-populated with regions and the triage color. Again, what is that information? That EMS and ETA information, we can get that right from that initial MRCC hail. The age and gender, chief complaint vitals, and any other details. So here's an example of our template that we use for TTAs, for example. When you guys call in and give your initial MRCC call, you can see here that just in that initial call, we can identify your unit ID, that it's a TTA because you'll notify us with that right away. The hospital destination, which we have chosen regions here, that gets us to the right template, and then your ETA. Once then we acknowledge that we are ready for your report, you'll continue on with your report, reiterating your unit ID number, your what you have, your age and gender, the chief complaint with, of course, this is a TTA, so we want to know mechanism of injury. We want to know those other pertinent information pieces like your GCS. We need a full set of vitals, including the blood pressure. And then we want to know about their airway. Are they intubated or not? Now that you've seen the templates that we use here at East MRCC, let's talk a little bit about what we need from you to make sure that we are getting clear and concise information, and we go over exactly what's needed on this report format card. At the initial call, when you're notifying MRCC, what we need to know is we need to know who's calling us and what do you need from us? What's the patient acuity that you're calling about? Are they a red, yellow, or green? Where are you going and what's your ETA? So for example, if I'm calling East MRCC, I'm going to say East MRCC, medic 220, patient information, I have a yellow, going to regions, ETA 10 minutes. East MRCC then is going to reply and acknowledge that they're ready for your report. They're going to acknowledge by saying, Medic 220, go ahead. Once MRCC has acknowledged your report, you're going to continue on then with your patient info. What we want you to start with is repeat your medic number. If we are having multiple people kind of chiming in, we might ask one crew to stand by and the other crew to go ahead. That can be misunderstood, so always repeat your unit number before you start report. So Medic 220, I have a 46-year-old female coming in with abdominal pain, 10 minutes out from regions, yellow. Clear, concise, simple. If there's not a lot to go along with it, you don't need to go say anymore. It's clear, it's concise, we know what's coming. If you have any abnormal vitals, if you did a blood sugar, if you did any interventions, those are the types of things we want to know along with your patient report. When you are reporting out on a red patient is where we need more detail. So if you reply with that report saying you have a red patient, we need a full set of vitals. We want to know kind of a little bit of history, interventions. Was there any response to that treatment? If it was a trauma, what was the mechanism of injury? What's their GCS? Do they have a patent airway? Are they able to manage their own airway, or are they going to need to be intubated? Were there EKG findings? Did you work a cardiac arrest and you got ROSC? Is this a stroke? And when is their last known well? What was their blood sugar? Those are all the really important things to relay to MRCC that the hospitals are going to want to know upon arrival. When you have a trauma patient and you've called out a TTA or trauma team activation, they need a full set of vitals that will, and a mechanism of injury, because that's going to help them determine, do I need MTP for this patient? And should I have that ready when they get here? When was the last known well? You called out a stroke. Was their last known well 2 hours ago? Do they qualify for certain interventions, or was it 24 hours ago and they don't qualify for those interventions? Those are the important things that we need to know from MRCC so the hospital can be prepared for your arrival. Now that you understand what's needed in the report, let's talk a little bit about some of the pertinent information that's needed with their specialty needs cases. So patients who are in crisis, those would be considered one of those specialty needs. You might have a patient that is suicidal and you're bringing them in and you call and you have a patient chief complaint of suicidal ideation. Did that patient ingest anything? Did that patient do anything to harm themselves? That is a very important piece of information because it will determine where the patient needs to go. Most hospitals have a certain designated area that they can put their patients in crisis. But if they've had an ingestion or an injury, they need to go to the medical part of their emergency department and be treated and cleared from that aspect before they can go back to a locked unit or a specialty unit. Other specialty needs would be patients that are in custody or they have a hold status. Those patients, although they might be green, they can't go to triage. They have to be in a room because they are in custody. Is there a security need? Is your patient restrained and maybe they were aggressive on scene, so they had to be restrained? And you want security there when you get there before you release them from restraints. Other things to consider would be ETOH. Does the patient need an interpreter? That's helpful for the hospitals to know when you arrive so they can have one available to do their assessment. Is this patient a transfer from another hospital? What are the patient initials? Sometimes these patients are actually going directly to the floor, but they come through the ED. That can create some confusion. If the patient even is a transfer coming to the ED, there's a certain doctor that probably took report on them. They might want to send them to that unit. So provide that information if it's a transfer along with the patient initials. So let's talk a little bit about EMS command structure. Across the metro, including East and West, the incident response plan was developed and used across the metro to help identify incidents and get the resources needed at the scene. So on the back of our card here, we have just kind of a quick guide for you so you know what to do in that instance. So first you want to do is call out your CAN report on your initial radio report. So conditions, actions, needs. If you guys need a medical director, a clinical supervisor on scene, you need, maybe this is an exposure, you need ChemPack activation, you need the MCI bus. That's what we're here to help get those resources for you. Every incident is going to have a certain size. Along with in the ERP, we have EMS plans. EMS plans are used across the metro as well. We have EMS plan 1, 2, and 3. Really what that means is the number of resources needed at that scene. Is it how many ambulances? It's how many medical directors. It's the MCI bus. All those things are part of, built into those EMS plans. We can then send out that notification in Mintrax, so all other agencies and mutual aid partners are aware of what's happening and can help support when needed. So some of the biggest things that we see in trends in giving report is not saying the triage color right in that initial identification on the radio. That's a big opportunity for EMS to make sure that East MRCC is pulling up that right template like you saw earlier. Do we need a red template? Do we need the trauma team template? These are important because those templates activate specific teams. So we need to know that information right from the beginning. Other things that are important to make sure you're communicating right away is ETA. ETA can make a difference of having somebody ready for you or not. When the radios are busy, if you call in and you have a red with a 2-minute ETA, but somebody else called in before you with a yellow 5-minute ETA, we're gonna prioritize your call. So in making sure you tell us that acuity, if you need an activation, and your ETA helps East MRCC prioritize to make sure that we are getting notification to the hospitals as soon as we can. So we've covered a lot today. So thank you guys for joining and staying along here with us. Just as a recap of the ways that you can get a hold of East MRCC via the East MRCC radio channel or our phone number, which is listed on our radio format card. The card is available for you guys. If you need one, please ask and they can provide one for you. So thank you again for joining and be safe.